Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Oxcarbamazepine. Oxcarbamazepine are also called as eslicarbazepine. Oxcarbamazepine or eslicarbazepine is actually used as an adjunctive treatment of focal seizures. So this oxcarbamazepine has low toxicity when compared to carbamazepine. It has low autoinduction when compared to carbamazepine. It has low hepatotoxicity when compared to carbamazepine. It has low interactions than carbamazepine. Then it causes more hyponatremia. That is, it causes more hyponatremia. Thus, there is increased chances of development of syndrome of inappropriate antidiuretic hormone in with oxcarbamazepine or esclicarbamazepine. But the problem in this oxcarbamazepine or esclicarbamazepine are that is side effects. Sorry, the side effects are less in oxcarbamazepine and esclicarbamazepine.
thank you and thank you for watching.